In the meantime, this morning, we're sharing the journey of one man whose curiosity led to a discovery that changed the way he viewed his health and the health of those around him. Lauren Lennon joining us from MUSC, where this patient received a diagnosis he wasn't expecting. Lauren.
Yeah, Mel, well, it's not every day when genetic testing comes to mind when you think about your health, and that was the case for one patient who found himself participating in one of MUSC's programs that provided genetic screening, and those results that he received turned out to be life-changing. Carson Thomas considers himself to be a healthy person. So when his wife, who had just been diagnosed with colorectal cancer, encouraged him to participate in MUSC's genetic testing program, he wasn't necessarily expecting life-changing results.
I was more interested in the personality traits and the ancestry part of the whole program. So that was kind of exciting to me. I wasn't really even thinking about any medical information that I was getting.
MUSC's In Our DNA SC project shows people what health conditions they may be at risk for. And it's through this project that Thomas would receive one phone call that would change his outlook on his health.
And they were calling me to say they'd gotten some results back from my genetic testing, and I had a genetic mutation, MSH2, that was associated with Lynch syndrome. So I'm at higher risk for colorectal cancer, prostate cancer, bladder, pancreatic, brain cancers, and obviously skin cancer as well.
And it's a good thing Thomas and 78,000 other people signed up to be tested.
Top two causes of death in South Carolina are heart disease and cancer, and so we know that some of those patients with those conditions have a genetic tendency, meaning it runs in their family. As part of our program, we're able to screen the genes that are most commonly involved with those two conditions. Among people who've signed up, of those 78,000 those who've had all of their genes analyzed, 1 in 65 has a positive result, which means that they have a major change in one of those genes indicating a tendency to cancer or heart disease.
Dr. Judge says majority of the people who have a positive result don't even know about the genetic abnormality, which is exactly what happened with Thomas.
I'd never heard of Lynch syndrome. It's not rare. 1 in 279 people have it. The rare part is only 5% know that you have it, so there's 95% of these people that don't even know anything about it.
And Thomas wants to make sure other people are aware of what's in their genetics.
Like I have an obligation to advocate and, help educate people and spread the word. There's more hereditary cancers out there than just Lynch syndrome, so you have to be aware of which genetic mutation you may have and how to prepare for it and how to protect yourself.
And Thomas says this diagnosis has given him more control, the opportunity for more control over his health. Now, he does have routine testing since his diagnosis, and him and his wife are advocates within the community for people to get their genes tested. Working for you, Lauren Lennon, News 4.